South Korea reported a surge in COVID-19 cases today from under 100,000 on Tuesday, rising now to more than 171,000. But the authorities are telling people not to worry too much because the medical system is holding up and the Omicron variant has proved less lethal. Choi Min-jung reports.
South Korea reported its highest ever daily COVID-19 tally on Wednesday. The country saw 171,452 new cases, up a whopping 71,000 from the day before. More than 100,000 were confirmed in the capital region, with Seoul seeing more than 40,000 cases for the first time. There was also an increase in the number of severely ill patients, coming in at 512 and 99 more deaths. Authorities pointed out that the fatality rate drops to the same level as the seasonal flu at 0.08% if people have received booster shots. Despite the current surge, authorities say that people should not be too worried as the country has already established a system that is responding effectively against Omicron.
Although we should not be loosening our vigilance and execution of antivirus measures, there's no need to be overly scared about the number of new infections.
Officials said that the rise in infections in the short term means there might be a spike in more severe cases and deaths. But they also stressed that in the long term, Omicron is known to be less lethal than the Delta variant. Authorities also hinted at the easing of prevention measures once the Omicron wave hits its peak. This includes possible changes to social distancing rules as well as vaccine pass mandates. Meanwhile, the Ministry of Food and Drug Safety on Wednesday gave the green light to administer Pfizer's COVID-19 vaccine, specifically made for children aged 5 to 11. The ministry approved the use of the vaccine in smaller amounts, with 3 weeks between first and second shots. The shot has been shown to be 90% effective against COVID-19. The government says it will announce details on the inoculation plan in March. This comes as there are growing concerns over the increasing number of infected teenagers and children. Currently, 1 in 3 new infections reported are among those aged under 20. Cases among kids aged 9 and below have more than doubled over the past week. Choi Min-jung, Arirang News.